right. Well, good morning, beautiful people. Believe it or not, it is August already, August 2nd, 9:02 a.m. Again, thank you for being on the call this morning. Very, very much appreciated. And as we're getting ready and geared up for AEP 2022, I just want to remind you guys again why we're here and why we have this drive to go out there and do what we do. And just keep in mind, guys, that our mission is to improve the lives of our community with affordable health care. Okay, so that's what gets me up in the morning and helping others. And hey, we make a little bit of money doing it, so it's a great thing. So first up, obviously, we've got training, and it's a little light this week. So this is a great time to go ahead and double back on your certification. So there's not a lot of training this week. And so just this morning at 11 o'clock, we've got Devoted that's doing their broker and coffee chat. That's this morning at 11. Nothing going on Tuesday or Wednesday. On Thursday, Devoted's doing their coffee and chat session again at 11:30. That one's for the Jacksonville market. But again, anyone that's selling Devoted can do that. And then Friday, Aetna's rolling out their plans for 2022 in Central Florida. I'm going to talk about the first looks in just a few minutes because there are those sessions that are happening across the country. Really, really important that you're checking your email, so we're gonna touch on that. But other than that, there's really not a lot of training this week, which means that you definitely have to do your certifications. Get those certifications out of the way. If you haven't been doing them, do one a day. Okay? I know it seems like a lot, or one every other day, and you should get caught up. So if you have any concerns on whether or not you're ready to sell, you guys know you can reach out to Jessica or someone on the HPM team, and we'll be glad to connect you and make sure that you're RTS for 2022. In the past, some of these carriers did require you to do face-to-face certifications or face-to-face class in order to get RTS ready to sell, but that may not be the case this year. Obviously, because of the state of the union, state of the world right now, they're not making face-to-face mandatory. So unless it's specified, all you need to do is just take those online certifications and you should be good to go. So please, this week is a very, very low week. This is a great week for us to go ahead and get those certifications done and out of the way. So it's really important that you spend time doing that, okay? Now, on the recertifications, although it seems like it's a far ways away, your very last day to get recertified is November 30th, okay? Because on November 30th, that's the last day that you can write for 2021, and you must be able to write for 2022 on December 1st. So you absolutely have to be recertified by November 30th. And again, it doesn't seem like it's far, it's far away, but it's going to sneak up on us really quickly. So please, please, please make sure that you have your recertifications done and again, out of the way. If you do not recertify by November 30th, I'm going to repeat this, if you do not recertify by November 30th, you will not receive your residual commissions in December, and it will stop, okay? Some carriers are lenient, meaning that they'll suspend you. Other carriers say, well, too sad, you've got to recontract and you've got to do everything all over again, and by the way, we're not going to pay you your commissions. So it's really, really important that you, in order to maintain your renewals, your residuals, all that hard work that you've done out there, all those people that you're helping, don't work for free, guys. Don't work for free. Get those certifications done. They're going to average about 2 hours a piece, okay? So make sure that you get that done and out of the way. All right. So I mentioned that the first looks are starting to roll around for the carriers, and this is where the health plans are rolling out their 2022 benefits. They're kind of giving you a sneak peek, and I'll come back to that in a minute, of what the plans are going to look like in your area for 2022. So we've already seen WellCare, we've already seen Devoted, Aetna's rolling out, United Healthcare is rolling out. So please make sure you take a few moments, a few minutes to really go through those first looks. They're doing webinars online, so you can go online and watch these webinars about the first looks in your specific area. And they'll also have PDF files that you can download. So we're going to start collecting those PDFs and hosting those in the gold queue like we do every year. And so we'll pull those out and go through them and put some highlights on there for you. But in the meantime, you're going to get these emails, and instead of waiting for us, go open those emails, go watch these webinars, and download those PDFs so you have an idea of what the plans are going to look like for 2022. Now, again, these are first looks, and again, it's a sneak peek because these benefits are filed with CMS, but they do still have a chance to change them and maneuver them up until a certain point. So these are not official benefits. The official benefits are going to come when you start to receive your summary of benefits from the carriers, okay? So they do have an ability to tweak these a little bit, but for the most part, they don't tweak them too much. We've seen some plans that roll out some additional benefits last minute or have been waiting for CMS for certain items to get approved. So we might see a little bit of a bump here and there or removal from a benefit here and there as time goes on and doing these things. But it's important to know at least what the benefits are going to look like for 2022 so you have a snapshot. Because I know many of you are calling your clients right now, building that relationship and ensuring that they're going to be with you for 2022. And that's really what we should be doing right now is checking in with our clients, making sure that they're doing okay, and letting them know that you're here for them in 2022. And I'll tell you personally, I've gotten a call from a client from many years ago, called me and says, hey, I need to change my plan in October. And so those are the calls that you have to stack up and get ready for open enrollment. And if you're going to wait for those calls to happen, it might be too late. So do yourself a favor. If it's a slow week and you've got all your certifications done, this week right now would be a fantastic week to call each and every one of your clients. You can call them, you can text them, you can email them, and you can get them together and see what you got to do for them for AEP. So just getting organized and getting ready for all of that, okay? The other thing is we've got some folks that have licenses in multiple states, and I'm going to mention this because this came up for HPM Shop. And once you do your certifications with the carriers, most of the carriers have a global training. So, for instance, if you did your Humana training, then your Humana training is complete for both Florida and any other place that you might sell, like Georgia or South Carolina or Alabama. So once you do your Humana training, you're good to go in all the states that offer Humana, okay? Now, some carriers do require you to go in and do a quick certification or a quick overview of that particular state. So it's important that you check in with each manager at each state for the plans to make sure that you're RTS. And again, Jessica can help you with this to make sure you're good to go. But also do that, okay? Now, moving into HPM Shop, if you are in multiple states, and let's say you're selling in Florida, but you also sell in California, the plans are only going to be loaded right now for Florida, but you must make sure that you load in California. The plans have to be loaded per state, per agent, and it's per year as well. So it's really important that if you're selling in multiple states, reach out to John Minotti, and he will check in and make sure that you're ready to sell in those other states, because he's got to load those plans for those other states in that area as well. So if you're selling in multiple states and you've got, let's say you're in Georgia and you also sell in South Carolina, then you've got to make sure that you've got your plans loaded in South Carolina. So HPM Shop has the ability to move across the country. You can sell anywhere at any time, remote. It's a fantastic system. But you also have to do your due diligence and make sure that you're ready to sell in those areas. And now's the time to do that for both 2021 and also getting ready for 2022. So take an inventory of where you are, where your health plans are, and if you have any questions or any concerns or you want to double check or triple check, you're ready to sell status, please reach out to us, and we'll be glad to do that. And then also, after you've got your ready to sell status, go into your HPM Shop and check in each area that you're selling that you can pull up the plans. Okay, this is important. So you're going to have to test this too, because the last thing you want is you get a lead from another state. You know, I'm here in Florida, but I get a phone call from Texas, and I go to run the plans, and my plans aren't loaded in Texas. Okay, that's going to take a few days for John to get those loaded, maybe even a week or so. So you don't want to lose that lead just because you weren't prepared, that you didn't have those plans loaded and ready to go in HPM Shop. So please make sure you just double check that, because I know several of you are selling in multiple states, and you don't want to get caught, you know, looking like, oh no, my plans aren't there and I can't help you. Okay. All right. So shifting gears very quickly into ACA, and ACA is still going on. It's still crazy, crazy, crazy. We have until August 15th to go ahead and help people find a health insurance plan, because the SEP has been extended until August 15th for a September 1st effective date. We don't know if this is going to be extended again, but it's unlikely, knowing that, you know, OEP is coming up for, or open enrollment is coming up for ACA Business on November 1st. Okay, so the business is still out there. You know, go talk to people. It's really important that you get familiar with Health Sherpa, which we're going to talk about on the next call. But here we go. So this is a notice that's being sent out by the federal government. And what's happening is because of the American Rescue Plan Act, the federal government is going to be increasing some folks their APTC, their Advanced Premium Tax Credit. Okay, so they may be getting additional funding that will lower their premium, copays, and deductible down on your plan. So I'm going to read this, and these are the letters that are coming to your clients. And you got to know that you're getting these, because this is going to help them get a better plan. Okay, so so the first thing is this is a cover letter from the marketplace, and it says increased financial assistance. Notice to existing enrollees who are already eligible for advanced payments of the premium tax credits, or the APTC. Now these are letters that are being mailed. Okay. The federally facilitated marketplace implemented changes under the American Rescue Plan Act of 2021 to increase financial assistance for existing enrollees. Enrollees who receive this notice may have their financial assistance increased by the marketplace. This notice will encourage them to log into their marketplace account to see if they qualify for extra savings, decide if they want to update the amount they're using to pay premiums, and compare plans if they would like to choose a new one. Consumers will receive this notice starting in late July through U.S. postal mail only. This notice will not be available electronically. Okay? So even though that your members may have asked to get this information in their email, they're not going to get it in their email. It's going to be sent to them manually. Okay? So this is the template here. A couple of things I want to point out, because I know you guys are going to get this and you can read it yourself. The first thing is it says that your financial help may be increasing soon. Act now to choose how much tax credit you want to use, or choose a new plan for this year. So this is important, because your members, if they forget you or they want to try to do it themselves, they can mess up their plan or their APTC. So you want to reach out to each one of your ACA members and tell them, okay? Or they might already be receiving these letters and they're calling you and saying, hey, what's going on with this? Okay, so this is all because of the American Rescue Plan Act of 2021. So it's lowering the amounts that they need to contribute in premiums for 2021. So it's going to tell them what they need to do next. They got to log into their marketplace account, select their 2021 plan. They're going to report a life change, and then they're going to submit their application, and they should see extra savings. Okay. Now remember, if other agents know this and they bump into your clients and they say, hey, look, I can get you even more money or more premium or lower it, then it's a possibility that they can take your client. Okay, because then they go through the app all over again, which is stated right here in the letter, and help them apply and get a report of life change and change the agent on the application. So remember, keeping that tightness with your clients is really, really important, okay? So I made you aware. The letters are out there. They're being sent out starting last week, which was late July. I know that some of you have already received phone calls from your ACA clients that are stating, hey, I got this letter. So make sure that that you take care of them, and now you can explain what that is and what it's going to do for them. Okay. All right. Emails. Now we've been dealing with, I think about 2 months ago, we switched over to our new server, which is now on a dedicated server system for our websites and our email addresses at askhpm.com. Please make sure that you are logging into your askhpm.com, checking and making sure that you're receiving and you can send emails. We don't want you to be missing out on important information because we do send some stuff from time to time. So if you're not receiving the emails, please let us know so we can connect you and get them hooked up in on your laptop, your iPhone, your Android phone, your iPad, whatever you're using to check your emails. Please make sure that you connect with us and we got that hooked up and it's working properly. Okay. We've sent out notices, we've called everybody, but we're still getting, hey, I'm not getting my emails. Please make sure you take care of that because that's the last thing that we want is you guys not getting the information that you're supposed to be getting as well. Okay. All right, and the last thing on my list this morning, we're going to wrap up pretty early today, is the Marketing Match program. And some of you are going to take advantage of this right away, but I want to put it out there. So if any of you are looking to do specific campaigns, whether it's events or mailers or newspaper ads or whatever it is that you want to do, HPM is going to be looking to match your investment in your marketing. Okay, so please take a look at what you want to do for AEP, or even if you want to do it now, we're happy to help invest. And one of the big ideas here is that we may be able to get some of our carriers and some of our provider partners to match up as well. So let's say you wanted to do a business reply card mailer and you've got $500. Well, $500 wouldn't go very far, but if HPM put in $500 and a health plan put in $500 and the provider group put in $500, now you've got $2,000 worth of marketing out there for the price of $500. So it could really help you increase your lead sources and also double down and ensure that we can help you and help you grow your book of business by helping with your investment as well. I know some of you have not paid for your own marketing, and that's fine, but if you're not going to invest in yourself, you're just going to continue to get what you've always got. I know some of you have different strategies. Maybe you work with doctors only and you're doing great and fine, fantastic. Or maybe you do tabletops and it's really low cost, wonderful. Maybe you're doing seminars, fantastic. But if you want to take it a step further and invest in certain other parts of the business and other parts of marketing to generate leads, we're happy to help you do that. One of the tools that seems to be working really well, and not in every market, but in general, is the business reply cards. But you've got to do them in mass numbers, okay? If you do anything less than 1,000, you're going to be disappointed. So 1,000 business reply cards is going to cost you about $500, right? But if you times that by 4, you're going to be able to get 4,000 with all the marketing match dollars that are out there. So this is a concept that we're going to be rolling out to everybody. If you want to take advantage of it, please send me an email, and we'll be able to talk through it and create a marketing plan that works specifically for you and to help you grow your book of business. So that's the Marketing Match program. We're going to have more details rolling out, but just a little sneak peek preview on what we're going to be doing to help you invest in your book of business. So with that, it's 9:21, so we finished a little early, but I'd be happy to take any questions. So I'm going to go ahead and unmute us. So any questions this morning?
Yeah. Good morning, Justin.
Good morning.
How are you doing?
Wonderful. How you doing?
All right. To set up a time to discuss the mailing program. How are we going to do that? We're going to do a face-to-face with somebody, or?
We could do it remote or face-to-face if you'd like. Give me over an email, Will, and we'll coordinate it.
Okay. Thank you.
And we'll get together.
Okay. Thank you.
Got it.
Oh.
All right. Any other questions this morning? All right. Well, fantastic, everyone. Thanks for being on the call this morning. We'll keep it short and sweet. And, again, if you need anything, you guys know how to reach us, 844-696-3975. And we're here to help you and help you grow your book of business. Thank you, guys, and have a wonderful week.